everybody, I am Thatnursingprof and welcome to my channel. In today's video, we're going to be discussing some restraint alternatives. I have previously posted a video on how to apply limb restraints, so if you want to check that out, that's like a skill video. I'll put it in the description box below. But before we would get to that point, right, before we would need to do restraints, we're going to try some other things first. Restraints only should be used after all other interventions have failed. They are our last resort kind of thing. The American Nursing Association actually has some standards when it comes to restraints that you need to be familiar with. The first of which is education. So you, the nurse, need to know how the restraints work and how to make sure that they're used safely and properly. You need to document everything, and you need to know what you're supposed to document and enforce documentation amongst your peers. And then the final thing is restraints should only be used in a setting that is staffed appropriately. So if you're short-staffed or if you don't have enough help, then restraints might not be considered safe for your patient. So staffing levels does play a role in restraints. So now that we've talked about that, I'm going to share with you 12 alternatives to restraints. So the first thing we can do is identify things that can trigger the patient to have those bad behaviors that could cause them to need restraints. So identify triggers and then either remove them if we can or minimize them. We need to assess their medications for adverse effects. Now, sometimes we know they're on the med and it's going to cause these effects and there's nothing we can do about it. But sometimes we can. Maybe there's an alternative medication. Maybe there's another medication we can give to help deal with these side effects. Or maybe, just maybe, they can discontinue that med altogether. So we need to really look at their medications and seeing how those are affecting the patient and kind of changing their behavior. And if it's something we can get rid of or reduce or replace, let's do it with a doctor's order. We want to assess the patient for pain and treat them as appropriate, because pain can cause a lot of those behaviors that might cause somebody to need restraints. So doing something as simple as a pain assessment and treating it as appropriate is going to help reduce those behaviors and reduce the need for restraints. Reduce environmental stimulation and noise, because these can be triggers that can trigger those behaviors why someone might need a restraint. Explain the reasoning behind everything you're doing. Now, we should be doing this with all patients all the time anyway, right? But it's very helpful as a restraint alternative because if your patient is in the right frame of mind and you are able to explain things and they're able to understand why you're doing what you're doing, there is an increased chance of compliance and then they won't need the restraints. You can use distraction or redirection for your confused patient. Increase the frequency of patient interaction and rounding. So sometimes, let's say back in the day, old school stuff, they used restraints more often for patients who were fall risks. So another way we can do that if somebody is a fall risk to prevent falls is to increase the frequency of our rounding, so hourly rounding, and that will minimize their falls and minimize their need for restraints. A few more we could do. Camouflage tubing or other equipment. The number one reason most people get put in some sort of restraint is because they are pulling at their tubing. So maybe they have an IV on their arm and they're yanking it out, and of course we need them to keep it in. So doing something simple like camouflaging it with like bandages or even just their shirt or clothing can help. Now, some of these things we can't do that with, right? An NG tube is right there, they're going to see it. But if it is something that we can hide, that they can't see, and it's not going to trigger them to want to pull it out, try to hide it as best you can. Move them closer to the nurse's station. So just like before, we're checking on them more frequently, we're rounding on them more frequently. Patients who are closer to the nurse's station are more easily observable. So we can keep a better eye on them if they're closer to the nurse's station and they are less likely to do behaviors or do anything unsafe or dangerous that would require restraints. Make the environment as home-like as possible. So one of the reasons that patients kind of get into this situation where they, get confused or they get restless or upset, they have these behavioral changes that may require restraints, is because they are in an unfamiliar setting and they're very uncomfortable. So doing our best to make the setting as home-like and comfortable as possible is going to help decrease their stress and make them feel a little bit better, and they're less likely to engage in those behaviors where they're going to need restraints. Have a sitter to provide both companionship and observation. So this is what we do quite often, at least in the hospital setting. So if you have a patient, you're concerned, you think maybe, restraints might be a possibility here. A lot of times before we jump into that, we will provide a sitter. So this is a person, usually like a PCT or a CNA, sometimes even a nurse, who is going to sit in the room with the patient, stay with them, chat with them, and kind of hang out with them and watch them and make sure that they're being safe. And then the last one is not going to be appropriate for a lot of patients, but it might be for some patients. So if it is safe and if they're capable, have the patient walk around. So walk in the halls. If you have staff, have a CNA or a PCT or even the nurse, walk with them. So this helps kind of focus their energy. It gives them something to do. A lot of times people who are exhibiting behaviors where they might need restraints are just very restless, right? And they need to put that energy somewhere. So if it's okay, if they're capable, have them walk in the halls back and forth. Kind of give them something to do. It gives them something to do, it's a distraction, and it helps them get that energy out. So that was my video on 12 restraint alternatives you should try before you would do restraints on your patient. I hope you found this helpful. Don't forget to like and subscribe. If you have any questions or comments, please let me know. And if not, I'll see you on the next one.